Yeah. Talk to you guys.
There you go.
I can sit over there.
Yeah. I need somebody to look at over there.
Yeah.
That way it looks like there's a big audience.
Yeah, there we go.
Okay, and are we centered? No, we're
Yes.
not. You move that guy. Because your actual camera is off.
Yeah, do you want my actual camera on too? So we'll have double cameras?
Yeah, that looks good. Perfect.
And do you want both cameras on?
No, because we just see your slideshow anyway, so.
Okay.
Well,
Perfect.
since we have your view on here, the both of you, I don't think we need the camera view.
Yeah, I see what you're saying. Okay.
All right.
I will eventually give you more space.
I don't mind.
Okay.
I did learn on my last podcast, when I turn and talk to you, it cuts out the audio. So keeping like a little bit forward face when we're
Helps
like
a lot.
talking to each other.
Your hair is not going to be an issue.
Yep.
Oh, over the microphone.
It is.
Speaking of which. Okay, remind me how long you've been director, owner of Bethany. 20 years?
I've been a pelvic PT 24 years. And I have directed Bethany since 2005, 21 years.
21 years. Okay. I must have actually
22.
Does her mic need to be on the computer, or is it just
this will pick up
Yeah,
to
this
our
has
recording,
lights.
and so you mean her mic on Teams?
Yeah.
I don't necessarily think so. I think it'll pick up if we're across the room. I mean, we can put her mic on and put yours off. I think all of them are muted right now, right?
Mine is off.
Yeah.
I think it'd be best to have this one on since you're.
Because you're going to record Teams too, right?
Yeah.
Yeah.
They're
So
both
then we could always
recorded.
pull the audio off it if we
Yeah.
needed.
Yes, please.
And especially being nobody's on here,
Trying.
it's kind of fun to like, we can just roll with it.
This is actually really good.
Yeah.
You guys are my heroes.
Oh, thank you.
I walked in, I felt like a celebrity.
You are
Big
a celebrity.
ring.
We got you covered.
We might have somebody coming in.
Oh, okay. Let's pretend like we've been talking for 10
Nope,
minutes.
never
right?
mind.
Okay.
It's alive.
I was like,
Okay.
oh dear, I don't have slides up here
Oh,
that they can
maybe.
see.
Maybe.
Okay.
And I'm like, oh dear, I don't have slides up here they can see.
Yes, you do.
That's okay.
But they don't advance.
We'll sort it. We'll
Yeah.
sort it.
You know, come sit next to you.
Hello.
I'm so sorry.
Welcome in. You're perfectly on time.
You are perfect. We were
Yes.
just getting started. We were just getting started. You're totally fine. So
Thank you.
with that lovely entrance by Marquisha, we're gonna go ahead and get started. So good evening, everyone. I'm Dr. Obanula, for those who may not know me yet. And tonight we have Jessica Dorrington. Jessica's been a pelvic floor or physical therapist, I should say, for about 24 years or so. And she actually owns, well, I call it owning, but is the director of Bethany Therapeutic Associates, which is probably one of my favorite pelvic floor PT sources for our patients. And she's been running that clinic, which is very successful, for about 21 years now. Jessica has a lovely family. She has a really good culture on her team, and she's an amazing mentor. And now I like to call her friend. So,
Right back at you.
thank you. So today she is gracing us with some wisdom and some information about pelvic floor and how that ties into our core, and really, I guess, everything else that we do. So I'm going to give the floor to you. You can take it from there.
Yeah, thank you for having me. So excited to have everybody here and just get to talk about my favorite subject and really shed a lot of light onto it, because when we look at the pelvic floor, 90% of women experiencing leakage will reduce the intensity of their workouts because of the leakage. And even more will reduce how frequently they work out. They will reduce how often they're working out or work out for shorter periods. And then they take rest breaks to go to the bathroom. And as an orthopedic physical therapist, I know how important exercise is for our overall health and our well-being. And now with pre-peri post-menopause, I feel like that's the talk of the town these days, is that we know that strength training from the ages of 35 to 50 are the really crucial times where we can build enough strength. And we know from a cardio and bone protection, as we head in through many decades of our life, that we have to lift heavy enough, we have to exercise hard enough to be able to produce those muscle developments, our cardio developments, and then our bone. But if we're leaking every time, we don't do what we need to do, and that sets us up for not being successful in the next decade. So that's where pelvic floor really is so important.
Absolutely.
And so we're not alone. We can mitigate these pretty easily with Pelvic Health. I'm Jessica Dorrington. I have been a pelvic PT for 24 years before I couldn't even write it in the notes in insurance.
There you go. There you go. I always tell people that we are a young specialty.
Right?
So young.
So young. And before there was really a lot of research out there, but now there's becoming a lot. But I have this unique perspective because I'm also an ortho and sports PT. And I've treated a lot of Olympic and pro athletes trying to use their core and pelvic floor for performance, and then seeing the pelvic floor side of it for both men, women, and children. Because guess what? Everybody has a pelvis. Believe it or not, right? And like she said, I'm the director of Bethany and Rock Creek PT, and we have over 8 pelvic floor PTs. And I think what that tells everyone in the room is that there is a need for pelvic floor, and you're not alone. We have so many patients seeking pelvic floor now because we're beginning to get an awareness. So, and there is some really good statistics showing that pelvic floor PT is really beneficial, which is probably why you love to refer.
Oh, I love it so much. We get great results when our patients come back.
Right. The other piece of my bio is that I wrote a book called Strong as a
Yes.
Mother. And it's really all about pregnancy and exercise and how we can do that, because we're talking about women reduce their exercise and activity. But there's 2 times when women stop exercising. Number 1, if you have young children in your home, it's when we get our menstrual cycle, because we're afraid and kind of insecure about what our period means for exercise. Number 2 is when we have a baby. And the statistics show that only 15% of women still get enough exercise while they're pregnant. But we know if you work out while you're pregnant, you're twice as likely to get back afterwards. So the more we can do for our core and our pelvic floor during pregnancy, the more that's going to set us up to be doing the activities we love to do, like gardening for you, right? Running for me. And whatever that means for you is whatever activity you want to get back to. So what is pelvic floor? Pelvic floor, I have a hint. It's just muscles. My bicep attaches from one spot to another. My pelvic floor attaches from one spot to another. It's simply a muscle. And it's been very taboo in our culture for a long time to talk about, but really it's no different than saying the word elbow. It's no different than saying the word knee. And the pelvic floor is one of the greatest pieces because it's the basis of our core. I have to give props to these images because in writing the book, I can give credit to Sasquatch Books. All of these images I got to work with an illustrator.
Oh, nice.
And we designed every muscle and every movement and made sure every single person was in the correct ergonomics for the exercises. So it was a lot of fun. But this picture shows how, if you look at the core, the bottom of the core, you can see at the bottom, there's a small muscle that goes from basically the tip of your tailbone to the front of your pubic bone. You can see it creates a sling around the bladder, and that is your pelvic floor muscles. It's literally the bottom of the core itself. And so for the core, there. Fantastic.
Keep going.
Perfect. For the core, what we've noticed for the core is it really has 2 functions. One, it has this role that it's part of our muscle system. It stabilizes us for balance, for strength, for power. That's why 50 to 60 pro and Olympic athletes have come to our clinic to see their core under ultrasound, because we can show them how to get 2% better at their core, which means 2% more power.
Yeah.
So whether you're trying to jump, whether you're trying to run, as soon as the foot hits the ground reaction forces come up. They have to get stabilized in your pelvis, and that core and pelvic floor have to create that stability and then either transmit the forces back down to the ground if you're doing a squat or running, or if you're doing tennis or pickleball, then those forces have to go out through the arms. So it's that transfer of load, and that's what protects us from getting SI joint pain, getting low back pain, and getting some of the leakage that we're going to talk about, or pelvic pain as well. So they're really important from the muscular side. Yeah. And then there's everything you know from the pelvic floor side. So here you can see the muscles. They're just the bottom of this system, and they support all of our organs. And they have to do a lot of roles down here. I say they're like the specialty of every medicine, right?
Yes, actually.
It covers urology, it covers colorectal, it covers gynecology.
Everything. And I think patients are always shocked when I'm like, let's talk about your bowels. And
right?
Like, but why?
But
well,
why?
They live there too.
And if we get constipated, there's only so much room in the house. So now we're going to get leakage. And we think, well, why aren't my pelvic floor muscles working? But it's really because there's too much bowel.
Yep, that's right. That's right.
So my profession 20 years ago, when I started teaching pelvic floor, they came in and they said, will you just teach Kegels?
Please.
Just Kegels. I was like,
because there's nothing else.
There's nothing else. And being an orthotherapist, I said, yes, I'll just teach Kegels, but don't make me do any more. Yeah. But then I started seeing women going, I can go jump with my grandkids. I can go do activities. I can go stay over at a friend's house. My bladder isn't controlling my life. And I realized how much it impacted us and our quality of life. Yep. And to me, it was more important than when someone came in and said, well, I can't throw my ball to my dog 75 times. And I was like, well, throw it 74.
Yeah, you'll be fine.
You'll be fine. And so that began kind of what pelvic floor was just strengthening. And then we decided, well, now we said, well, if a muscle's too tight, now a muscle can't work.
Right.
So now we need to lengthen the muscles and maybe they'll get strength. Yeah. So then there was about a 5 to 10 year period where if you went to pelvic physio, we said, maybe your muscles are too tight. And that is the case in some instances. We can get the muscle to relax. But we go, why is the muscle tight?
Yeah.
A muscle doesn't just get tight on its own, right?
No, it doesn't.
Unless you're typing like this for 8 hours.
Yeah.
Then my neck is going to get tight. Yeah. So we have to go, what are the demands on it that are too much? And that's where our profession really started to say everything that we realized your profession was doing, saying
the alignment came in.
The alignment and the fascia. And you have prolapse where these organs tend to drop down into the space, and that's putting too much weight on the pelvic floor and making the muscles tighten. So our profession really caught up with you to align with what your profession was saying.
Yeah, but I mean, I think it's a two-way street, right? Like we definitely took a very, I am the doctor, I know what I'm doing. But, and I always tell people that where I trained, there were only like 2 pelvic floor physical therapists. And even if I brought it up, they're like, but why would you send them there? And I moved out here to Oregon and there were several, like 5. And I was like, there's twice as many, and I just loved seeing the blossoming of it, right? Because we knew we needed it, And so now when I'm like, let me tell you about how you can decrease your chance of surgery by like 40%. Let me send you, just go, So I love the growth. Yeah. I love it. So.
Yeah, it is. I've watched it in my company as well. We were the first in our company to do pelvic floor. We have 63 just in my company alone now.
Oh, wow, nice.
In the Pacific Northwest. And that just shows you there's so much more access to the knowledge, and people are really sharing the knowledge. Yes. And so it's really been nice to see. But when I was writing the book, you'll love this. I used to always say only 26% of women seek out healthcare for their pelvic floor.
Yeah.
And when you've been saying something professionally for a long time, when you're going to put ink to pen or pen to paper, you go, I better make sure that statistic is still right. It moved up to 38%.
Oh, okay.
So we're on our way.
Yes.
And maybe with some more collaborations like this, we'll see more
Absolutely.
of that coming.
I mean, I think like the work that we do lets women know, like, which is what I always say, with no suffering in silence, like no more, you know.
Yes.
And women are very good at advocacy if you will only allow them, right? They're so used to advocating for their kids, for their partners. And what our specialties are saying is that you have to advocate for yourself.
Yeah.
If you're not going to advocate for yourself, whether you like it or not, you can't advocate for those who you think you want to put first, right? And so one way or another, the woman is at the core of that. And so I think when they come in and they're like, is this a whole specialty? And I'm like, yes, and it's dedicated to you, right? And that empowers, and it makes them say, well, actually, this also is an issue, right? Can I talk about that here? And you know, to be able to give them that space is amazing. It's very rewarding work. And I also feel like when we extend that to our friends in the community, like pelvic floor, like occupational, like all of these other specialties who for a while didn't think it was worth the time, now you're opening eyes and you're opening minds, and women are like, there are options. I do not have to live this way, right? So.
And things like this, we just hope you'll hear some of these and say, well, maybe that is me. I have some of those symptoms.
Exactly.
So, and that's the same thing with why we wrote the book, is now you have knowledge is power, and you can go ask your physician and say, you know, I think this sounds like me. Could this be something that I have? Because we have more knowledge to advocate for ourselves.
Now, I don't know where your slides are taking me, but can we just pause and just talk about this book for just a moment?
Sure.
Okay. Okay, so I love this book. First of all, I love Jessica because of just her personality. You can tell already that she's just open. She's an open book. A lot of transparency. But I'm the mom of 3 kids, and I did not have a resource like this. And when she told me she was writing it, I knew it was going to be great. Okay, I said, how is this gonna look? I'm so excited. Do you remember? I was like, so when does it come out? And can I put it in my office? You know, but the book does not disappoint. Okay, it really doesn't. And the reason why I like this source is because we're busy. Okay, it's not fine print. You can get through it. That's to me, I'm a visual person. That's the first thing. And being a visual person and living in a visual society, there's a lot of imagery to keep you engaged, so that you learn what you need to learn about your body. And you're learning it in a time of life when a lot of people are focused more on the person you're growing than the body you're trying to protect. And again, this is permission to take care of yourself, right? What I love most is that a lot of my women who are past reproductive years, I come out here to get them, and they are deep in this book. They are like, so if someone had told me how to, you know, but it's still knowledge, and they share it with their friends and their daughters and their granddaughters. So I just encourage everyone to check out this book. I'm legit proud of this piece of work, and it's here in the office, but I encourage everyone to get a copy. Hopefully, you know someone who would like to be pregnant one day, and so reach out to them. And this is the best. What is it? What is the book called? Getting pregnant. What's that? What was that?
Oh, what to expect when you're
What to expect when you're expecting that. That's the book I told no one to get me. This is the best book. Like, this should replace. Okay, I'm dead.
Oh, right. You're amazing.
So that was my aside, but
well,
good work.
Once postpartum, always postpartum.
Yes,
so
absolutely.
All the information in here is all the things about pelvic health
100%.
And how to do pelvic floor exercises, what those symptoms might look like. So we try to pepper in everything. It's not just about pregnancy. And truth be told, all the exercises are my favorite exercises to get someone back really strong and healthy in a graduated way. So I told my publisher we need to create the next one called Strong as a Woman. And just take out the pregnancy part, because that's really what this book is about, is being strong as a woman, regardless of what decade of life we're in.
I love that.
But so back to the slides. Okay. You know, they're probably the most boring part. But you know, some of the symptoms, as we were talking about, to advocate is when you think about the pelvic floor muscles, you can see that they sling around. And if you can hand me the pelvic floor model, if you see the pelvic floor, they are literally just a group of muscles that you can see. And do you want to turn on? You can see that?
Yeah, we can see it, yeah.
So they're a group of muscles, and the deepest layer of muscles looks like a hammock, right?
Yeah.
And their job is, they're called levator ani, to lift the anus, right? You can see they're lifting up.
Oh my God, levator ani.
Levator ani, lift the anus.
Never put that together. Thank you. Thank you.
All those
Wow.
Latin terms, right?
I
But they also are designed to really hold that bladder and bladder neck up for a long period of time. So if everybody wants to practice theirs in your chair and then at home, you can kind of slouch in your chair. And I want you to think about closing the opening. Like we're all stuck in an elevator and you don't want to pass gas. And see if you can feel that muscle around kind of the anal opening. You should at least feel it close. If you feel it lift up towards your nose a little bit, that probably means you have enough strength of the levator ani without us even doing internal exams.
Wow.
So this muscle is really important for holding that bladder neck up so that we don't get leakage and getting some of the prolapse. It also, you can see, is part of the opening or guards part of the opening. So it has to stretch a lot when we have a baby. And some of those muscles don't always come back quite the same. Both Chi-Chi and I can measure that to see how much that is compared to your strength. But you can see those muscles prevent prolapse of the organs prolapsing through that section. So we don't want these muscles to be too wide open or the organs can start coming through. So let's say I want to go CrossFit or jump on the trampoline with my grandkids or go do some high level activity. If my pelvic floor muscles are strong, even if this opening is too large, I probably don't have a huge risk of that prolapse. But if my pelvic floor muscles are weak and that's largely open, I might tell someone to say, you know what, maybe let's stick to moderate activity instead of high level activity until we can get strong enough, or until you can go see Chi-Chi and either do consults of surgery to help with that, or pessaries, which I call them an ankle brace.
Oh, okay.
Or like eyeglasses. You know, you just sometimes need eyeglasses.
Little support.
Just a little lift, which can help hold up those organs so that we don't get so much of that prolapse. And then on the flip side, there's muscles that are on the very front of the pelvic floor that they go around and clamp the urethra. And they have to close that urethra off. And if urine's coming out of that garden hose, would you want me to stomp on that quickly or slowly? Quickly. So everybody arch your back now. And now think about closing the muscles like you're going to stop urine flow. You should feel more of the muscles up more towards the front of the vaginal opening. And those muscles have to be able to contract quickly. So squeeze, relax, squeeze, relax, squeeze, relax. And for orgasm, they actually have to contract, this is nerdy, at 0.7 seconds.
Oh, even
so
fast.
They have to be really fast. So we want fast contractions of those. So it's not just about strength. It's about coordination. It's about if you are going to contract those muscles, let's say every time you cough, you get a little leakage. You pre-contract them, and can we get them pre-contracted to be able to do that? So there's coordination, there's strength, and then there's also endurance. Kind of like marathons and sprinters.
Yeah, I mean, those are all the same key words, right?
Right?
Crazy?
Yeah. And then if these muscles do get too tight, then we can have issues with constipation. We can have issues with starting to get our void, or a lot of pelvic pain that comes from that area, whether that be from exams or whether that be from intercourse. And so there's ways we can get those muscles to lengthen as well. So where'd my cursor?
Oh, sorry, I stole it.
You stole my cursor.
You got it.
So back to the core. This is just the bottom of the core. And the core is all of these muscles. We have six-pack ab muscles and we have oblique muscles. Those ones you can see when I move, when I use my big core. So my big core or my powerhouse, you can see obliques will rotate me, six-pack abs will bend me forward or do a crunch. But when you contract your transverse abdominis or your local core, you don't see anything that happens. And transverse on here, you can see is this muscle right here that wraps around and it creates a lumbar corset built out of muscles. So let's practice how to contract our transverse.
Please.
We're going to take and let your belly relax. You're going to breathe into your belly. And then as you exhale, just pull your belly button to your spine 1 inch. That's it. Take a breath in. As you exhale, belly button 1 inch. If you think or wondering, maybe do I have to learn how to use this muscle? Because it should turn on automatically, but it sometimes doesn't if we've had back surgery, abdominal surgeries, cesareans, because it's cesarean month.
Yes, it is.
Sometimes that muscle won't turn on automatically. So if you're standing on one leg and you lift one leg up, and then you do one of those contractions again and see, does it make it feel easier? Then you might need to learn and spend some time working on your transverse abdominis.
Fascinating.
Because it's a stabilizer muscle. Okay. So the other thing we will talk about is whoever's stronger wins.
Okay.
This is where your testing really comes in. But when we look at the bladder and we say, I have incontinence issues, it's not just the pelvic floor. Because this pelvic floor sits in an entire system. And inside the abdomen, there's a pressure. So if I cough and I cough downward, I put a lot of pressure down in my abdomen, which puts a lot of pressure to squeeze on my bladder, which then puts a lot of pressure on my pelvic floor. And it's whoever stronger wins. If the pressure from above was more than what my pelvic floor could do, who wins? I leak, right?
The leakage.
So you can minimize that by, if you do a cough, you lift your head up and then cough. Or if you're going to sneeze upward. Now you don't get all that intra-abdominal pressure on. Or you'll hear people talk about breathing as part of the pelvic floor. Research shows it doesn't coordinate quite as much as we thought with the diaphragm and the pelvic floor. We used to think they really were in sync with each other. But really what we're finding is if you blow as you go, so you, as you're standing up, you're exhaling, you're moving some of that abdominal pressure out.
Wow.
Likewise, if you want to lift weights and lift heavy, but you're feeling prolapse symptoms or incontinence, if you lie on your back and do a bench press, there's less abdomen pressure. If you lie on your back and do bench or biceps curls or anything lying down or crunches, there's less pressure on the pelvic floor. So we can get by with a lot of exercises that really get us strong without getting some of the leakage. There's ways around it all.
Fascinating. Fascinating. I love that.
And then the other thing that happens, so we talk about whoever's strongest wins on the bottom. This is where my profession's catching up to you. We know the muscles and the sphincters control the pressure on the bottom. We also know how important hormones are now, because hormones impact the urethra and how much plump the urethra is. And so vaginal estrogen, talking to your doctor about getting estrogen can really be a key component. And pelvic PTs are actually screening for that now. We're looking for derm and really looking at saying, is this person somebody who should go back and see their physician? Because maybe it's not the muscles, and maybe it's more the hormones as a component.
Very nice.
Yep. Now, if you really want to check and see if your pelvic floor is strong enough, and maybe say maybe it's not muscle, go home. You can do a urine stop test. So largest void of the day for most of us. That's after
First thing in the morning.
and after maybe your morning coffee.
Oh yeah,
because you're a coffee drinker.
Oh. I am.
So maybe there's two in the morning. One when you wake up and one after all the loads of coffee. I know that's true for me. But so fill that bladder up, go to the bathroom, and go for 3 seconds and then start a stopwatch and see how long does it take you to stop the urine. And if it takes you more than 3 seconds, your pelvic floor muscles are probably not strong enough. So then you can start working on pelvic floor strengthening. And pelvic floor strengthening is a great place to start. You just learned how to do the muscles tonight. But the problem with it is that we know that doing a home program, we will only get about 17% better. So if you try Kegels for 12 weeks at home, it takes 12 weeks to build any muscle strength. Once we commit to the gym, we have to commit for 12 weeks. And if we start over, it's like my kids on Duolingo. You know, they like practice Spanish for like 2 weeks and then they stop for 4 months. You're back to square one.
You have to start over. Hola.
Hola. How do you say pelvic floor in Spanish? I don't think I know that one.
I'll have to find that one out.
But we can look at the strengthening, and you might get about 17% better by doing them at home. But if you don't, that doesn't mean you failed pelvic health PT. It just means maybe you need to go in for in-person sessions, because the research shows you'll get about 60 to 75% better doing supervised, but it has to be for 12 weeks. So I'll see a patient, you know, they'll come in for 3-4 visits and say, okay, now is the most important time. We can't stop. So,
and is that weekly?
It is weekly.
Ideally, right?
Yeah, it is ideally weekly. And we have biofeedback machines we can hook up so you can see the measurement of the activity. We have ultrasounds, we can see the muscles, and then we do visual and internal exams to really help guide and cue and progress the exercises appropriately. Would you be able to grab my charger in my bag? Because I think we're going to lose. Thank you. And then the other key about pelvic floor is we just all talked about it. And when I give large presentations like this, 1 in 4 people cannot understand a pelvic floor with verbal cueing. 1 in 4.
Okay, actually, I know exactly what you mean, because I try to have them do it on exam, and they're always surprised. But I'm like, we didn't move anything.
And then you have to kind of give them some different cues that work for them.
Now I do on their pelvic exam. I'm already kind of feeling the muscles, and I'll actually see if I can put, you know, kind of almost pinch the levator and say, what about this muscle? And then they're able to actually move the right space, and they're like, oh, I've been doing the Kegel the wrong way.
I've been doing it the wrong way. Yeah, we'll do like a quick stretch on the muscle as well. Or with our pediatric patients, we will actually we'll work on stimulating the anal wink reflex.
With a Q-tip.
With a Q-tip, or we have fun little like alligator vibrators and things that, like a facial stimulator almost. And you get that working, and all of a sudden they're like, oh, that's what the muscle is.
Interesting.
So there's lots of different cues and ways that people can learn, and everybody learns differently. So that's great. Okay. Saved by the day there.
Yes, thank you, Fiona.
And here's exactly what you were talking about is 40% get better. And that's really what the research is now saying is anywhere from 40 to 50% are cured, not just improved, cured with just pelvic floor PT. And there's no side effects.
No, other than maybe missed work. I understand that. But to be cured, I mean, that's worth it. To never have to come see me again about this problem, that's worth it.
And if not, I always tell people, well, start it, book your appointment. And then at least you'll know, and it's almost like prehab, you'll know your muscles are as strong as they can be to hold up whether you need a bladder suspension surgery. Now you've got the muscles holding that bladder up as best we can to make the surgical outcomes better. So now you've got the awareness around it.
It's really powerful. And I do, you know, one of the reasons why we keep our like preferred list, unfortunately, all PT is not created equally.
That is true.
So we try to send people to places like Bethany so that we know that those 12 weeks are well spent.
Yeah, and I think the biggest thing for that is looking for credentials. You know,
Okay.
as pelvic PTs, we can go to a 1 weekend course and say we specialize in pelvic health.
Okay.
We don't get much of it in school at all. So you can have somebody who's gone to 1 weekend course who's just getting started, who still has a lot of valuable knowledge. But then you can have somebody else who's gone to 40, 50 courses. They've taken national exams.
Okay.
And there's 2 big national exams. One is called the PRPC, one is called the WCS. So
Okay.
those are our 2 board certifications. If you're really looking for,
Oh, we're really looking.
I cannot, like, I want the top of the level.
Yes.
If they've sat for that exam, I actually just retook the exam.
Uh-huh.
I was the first cohort to take it
Uh-huh.
10 years ago.
Yeah.
And I got a call. I was doing a lecture. And I got this call and they said, you need to take your exam in the next 3 days.
Oh.
They had missed sending out that we
Oops.
needed to recertify. And I'm like, well, normally you study for like 4 or 5 months for this
Yeah.
exam. And it's $1,200, mind you.
Oh.
And so I signed up and they said, well, we can give you a week. So I signed because I was running a marathon, and they said, well, you could take it where your marathon is at. I said, no, I'm running a marathon. I'll take it when I come back.
Oh
So I
my
drove out to
gosh.
Tillamook to a testing center, took it blind, and I thought, well, if you practice this
Then
information,
you
you
technically
better know
should
it.
pass this exam. Now, was that before you wrote your book? Or
You know
after?
what? It was right as the book was going to publish.
Okay.
And
You were
the
deep in
PRPC
the
initials
research.
are on here, and I thought I can't have a book
Oh,
coming out
yes.
without my initials.
Oh my gosh.
With my initials, and I don't recert. So,
Oh Lordy.
but I passed.
Of course
So.
you did. There was
I
never a
passed.
question.
And it was fun to retake.
Yeah,
So
yeah,
fun
yeah.
to see the knowledge bank
Agreed.
in there.
Oh my gosh.
But so here's that detrusor we talked about. And one thing we didn't talk about is the medicine that's also helpful for detrusor.
Okay.
Because sometimes detrusor is a really strong muscle. So like in kids, for instance, I see kids with giggle incontinence.
Yes.
Their bladder is just spasming too much. Once they start that laugh, the laugh pushes on the bladder, and then the bladder
And it sets it off.
and it sets it off. For some of us, that could be one strong cough.
Yeah.
And so, again, not always is pelvic floor the answer. Sometimes we're sending to you or sending to urology to say, can we give some medicine to just calm down the bladder a little bit? Yep.
Okay.
And on the flip side, if it's not working enough, if we're a teacher who's held our bladder for 8 hours every day,
Or a nurse.
or nurse, or hairdresser.
Yes.
You see a few nurses in the room today, and I know what that's like. But then the bladder can get overstretched and it gets hyposensitive. So then we have to teach it to feel the sensation again. And there's lots of different ways we can use bladder logs and things to really help that detrusor start to work really well again. Okay. And then here we're just showing the prolapse. So you can see how that bladder is starting to drop in a little bit. You can see the uterus is dropping a little bit, and the rectum is dropping in. And there's lots of ways we can do that. Most of them we're sending over to you for pessary or for consult for surgery.
Yeah.
Is there anything you want to mention about prolapses?
No.
No.
Well, I think you've done a great job, and I love the visual that you bring, especially for patients. I was just gonna say that I've realized after doing this for several years that it helps our women when we're able to say, you've got a structural issue, and then we have a functional issue.
Yeah.
Structurally, is it too tight or is it too weak? How do we strengthen it? We can do that non-surgically with PT. We can do that surgically. But functionally, your bladder is either not responding or the nerves are overfiring. We can do that with PT, or we can do that with surgery. And patients are often like, well, what is PT going to tell me? And I'm like, well, turns out they're not all about Kegels, you know? And what I love about Bethany Therapeutic or Rock Creek Therapeutic and some of my other PT providers is that they're listening. And they're able to know when they're saying, this is what I can provide. There's a bigger picture. Let me send you on to get the full scope. And that is what I really appreciate. We get referrals directly from you. And these are women who some of these women have talked till they're blue in the face And their doctor's like, there's just nothing you can do, right? And so they bring themselves into your practice, and you and your team do this phenomenal job. You educate and you tell them and you empower them, and then you send them on to the provider. And I'm like, well, wow, how'd you learn all this? And they say, well, not from my doctor. Right? So there's just an awareness that everyone can play their part to get our women up to speed. So that's all I would say. I think that we get very appropriate referrals, from our PT partners.
Yeah, that's great. Yeah, and I would say the biggest difference, in anybody seeking PT, wherever you are, if you aren't making gains within 3 visits, at least some type of gain, then we may not be treating the right thing. I always tell patients, I can see that it could be this, it could be the muscles, it could be your diet, it could be your stress. Which one do you think is the most impactful? We start with that one, we treat it for 3, and then if we don't make progress, then we move on to the next one. So if you're, with a physio, you've been not seeing results, just asking if we can go back to the drawing board and seeing what else might be a piece of that, bless you, a component of that. And then the abdomen. So one of the things I was so excited about writing the book and being here tonight is breaking some of the myths that are out there in pelvic health. Yes. So we have a myth about the diastasis recti. You can see the muscles on the right-hand side where your 6-pack ab muscles have separated. And we call it a diastasis recti, and so much so that they did a study in Australia. I don't know if you ever heard this. They were recruiting for women on Instagram, and they said, if you have a diastasis recti, we'd like you to be part of the study. 72% of the women thought they had a diastasis and didn't. Wow. They self-selected thinking they had a diastasis. Oh, gosh. And we've seen this in our clinic. We didn't jump on the diastasis recti bandwagon too much because I've had an ultrasound for 15 years. Right. And every time I put the ultrasound on, I go, well, yes, the muscles are a diastasis, but there's this good posterior band of fascia underneath.
There you go.
They can transfer load. Let's just contract their transverse and move on to their 6-pack abs. And that's the way we practice. Well, now the newest research says we're trying to get away from calling it a diastasis recti because it's just an interrecti distance. The distance between the rectus abdominis muscles has gotten larger. And it gets larger in those of us who are hypermobile. So if we're more bendy, then we can do party tricks. If we have the less collagen in our muscles. But it doesn't necessarily, like you said, function versus muscles. Even though those muscles are further apart, it doesn't mean that they're causing an issue with function. Right. And so really, if anybody's been to pelvic physio in the last 20 years, told they couldn't plank, told they couldn't do sit-ups because of it, really the muscle that brings them back together, it's the 6-pack abs. There you go. So we have to plank, we have to do crunches during pregnancy and postpartum to prevent it from getting bigger during pregnancy and then to bring it back postpartum. And we're starting that as early as 3 to 4 weeks postpartum.
Oh, lovely. Wow, okay.
And then I put a picture on here because it's Cesarean Awareness Month.
Yes.
And scar tissue can really impede how our muscles function, whether that's a vaginal scar, whether that's a cesarean scar. I always use my finger as an example, but if I hold my finger up and I lift the skin, now I can't bend my finger fully. There's nothing wrong with my finger. There's nothing wrong with my joints. It's that the skin isn't allowing it to do it. Wow. And so that's how impactful scar tissue can be. And it's really important to have manual hands-on work in pelvic physio as well.
Fascinating.
And then the myth of, I get this all the time, I don't know about you, but I say, well, let's do some pelvic floor to help with your incontinence. And they'll say, oh, I'm too old, honey. I'm past that.
Oh, yes.
It's always a honey afterwards.
Of course.
I'm too old, honey.
It's our sweet ladies that come here.
And, it doesn't matter how many babies you've had. It doesn't matter if you're overweight. I've also heard people say, well, my doctor told me I just need to lose weight.
There's
And
that part. Yeah, I break that myth all the time,
Right.
actually.
And so pelvic floor can help everybody. And I have a picture on here because everybody has a pelvis. It's for men, it's for women, and it's for children.
There you go.
And the only times we're going to have less success is if you have severe incontinence twice a day.
Okay.
So if you're standing up and gushing your pants twice a day, that probably means you need to see Chi-Chi and not come into my office. Or if on first cough, see, I did that purposely.
Oh, did you? I could tell.
It was definitely purposeful.
On cue. Like my 6-year-old.
Right. But if on first cough we're getting leakage, that also shows that our pelvic floor sphincter muscles are really weak. And so we may not have as good of a prognosis. So coming into pelvic PT, we say we may not get as much better. So the same thing as if we have leakage with intercourse. Just because we're already laying on our back, there's not a lot of abdomen pressure. And so that leakage is going to tell us that maybe also we may not have as much benefit and gains.
Okay.
And then 8 times more likely to be cured or improved with pelvic training. I mean, I just think isn't that dynamite?
It's just such a mighty tool to have.
Yeah.
I hope the people in Atlanta have more PT.
And if you don't, come
Come to Oregon.
come to Oregon or DM me. We'll find you somebody. And this is the other big myth. You know, we see a lot of pregnant and postpartum patients in our clinic, and they go, well, I'm leaking, but, you know, I'm still nursing. It's normal. And we now know if you're still leaking at 12 weeks, so once you've hit the end of the 4th trimester, if you're still leaking at the end of those 12 weeks, in 5 years, you're still going to be leaking.
Wow.
And so really talk about advocating as moms. That is the time. That's the time to take care of it.
To learn more and find out. Exactly.
Yeah.
Exactly. You just have to, someone has to watch the baby, and you got to pump before the appointment, but that's okay.
Our babies come to our appointments.
Same here.
Clinic. Like, we love it.
Yeah.
We run a bump to baby program at our clinic. We've been doing it for almost 20 years.
Yeah.
And we see them as soon as they get pregnant. We help guide their exercise. We teach them birthing preference plans. And then we see them at 3 weeks postpartum. And they come in and they bring their babies. And COVID, I couldn't hold babies, but now I get to hold babies again,
so
which
sweet.
is really fun.
So exciting.
Got to do it before they go back to work, right? So what is pelvic floor PT? I get asked this question all the time. And the question really is, you know, what is pelvic floor PT? Yes, it's muscle training. We use biofeedback. We can do an internal exam, both intravaginal and intrarectal. It doesn't have to be part of your plan. You get to advocate and make your own choices. And it's really also about looking about how your spine moves and your SI joint and your back, because it's all part of the picture. So it's a lot of playing detective work on really what's driving the symptoms. Okay. So there's our summary. I think just that pelvic floor is vital. It's vital for our health and wellness, and really getting us back doing what we love to do is really what the most important thing, because we want everybody doing exercise and doing the things that they love to both for their mental health, for their cardiovascular health, and building healthy bones for being lifelong athletes. So we can open up for some questions.
That was amazing.
Yes.
Okay.
Can you over Kegel?
Oh, yes. Ask every pelvic floor therapist if you can over Kegel in your practice. But you can over Kegel in terms of like building muscle strength. I see this all the time because I see so many pro and Olympic athletes. Their pelvic floor muscles are super strong. And you would think if you did an internal exam, you would say, oh, they're actually too tight, but they're not causing dysfunction. So I think it really is about, a muscle will always take the force of the demands you put on it. No different than if I go and run a lot and my calves get really big. There's nothing wrong with my calf being too big. And for a while we thought those muscles, if they were hypertrophic or hypertrophied, that maybe that was a dysfunction. But if they're not causing symptoms, then I would say it's okay with where they are. If they can't get those muscles to contract and relax and use both movement patterns, then it becomes dysfunctional. Any other questions?
Should I only Kegel when I'm on the toilet?
Oh, this is a great question. Kegeling on the toilet, there's a lot of information about how long our urethra is. So you heard me say that urine stop test. I think we're going to find research soon shows us it doesn't cause bacterial infections, but as of right now, we don't have the research. And so you can do the urine stop test once every now and again. But until we have that research, when you Kegel on the toilet, urine's starting to come down. And then once you Kegel, the thought is urine might be going, touch the outside surface, go back up into the bladder and cause an infection. And for people with a penis or people who have a longer urethra, that's not a concern. But for those of us with a vagina, that has been kind of the antidote. So it's saying try it on the toilet then, but then try and do it more in lying on your back, sitting and standing in functional movements.
Behind the driver's seat.
Yes, behind the driver's seat. Yes. Anywhere you can remember to do it consistently for 12 weeks. Yeah, great.
So for our athletes who are worried about stress incontinence from the amount of impact on their pelvic floor, my thought is to have them do things like Pilates and bar on their off days. What do you think about what they should do to protect their floor? Is that the right advice for them?
Yeah. So first of all, if someone leaks before they've had a baby, they are more likely to leak later in life.
Agreed.
So any athlete, it used to be worn as a badge of honor, or people would think it's normal and just pushing so hard at the end. That actually shows that they probably have pelvic floor dysfunction, and later in life, they're 50% more likely to leak. Now, they've rated on different sports of who gets most leakage. And the ball sports, track and field athletes, and gymnastics, a lot of the ballistic movements can be up to about 50 to 75 or 80% can get leakage during those time frames. And unfortunately, bar and Pilates, they strengthen more of the external, those big core muscles that I was talking about. When they ask a powerhouse, they're getting some of the internal, but when we watch on the ultrasound, they're actually getting a lot of obliques, which push down on the bladder and push down. So it's strengthening their outer core, but they really do have to strengthen more the transverse abdominis and the pelvic floor. And the pro athletes that come see me, even we'll go away from strengthening that for a while. 6 months later, we'll go, oh, we need to re-engage pelvic floor and transverse training. So really looking at the smaller muscles. Yep, great question.
Well, I feel like I have so many more questions for you. We could probably sit here all night and chat.
Again, we'll do it again.
Absolutely. But thank you so much for coming. And I just love that you're so research oriented and yet still so personable, and you make it so relatable. So we appreciate you.
Well, and thank you for everything in the community. I mean, your space is beautiful, and it's just an honor to work alongside you in the community and really giving opportunities like this where we get to share the knowledge.
Yes, thank you.
Yes.
All right, till next time, guys. We're out.
Yay!
High five.
High five. That was fun.